Welcome, everybody, and thank you for being here. For an event as important as this one, we normally would have had a much splashier launch, but circumstances we all are familiar with require that we recognize this special program that is being initiated, even without all the goodies that would normally go along with it. So I'm Charles Bertolami, the Dean of the College of Dentistry here at NYU, and I'm really delighted to welcome everybody to the official launch of this collaboration between the dental school and the Department of Veterans Affairs to increase access to oral health care by veterans. The program, we are calling it locally the Veterans Oral Care Access Resource, or VOCARE. And if you took Latin, that also means to call, which is what we're doing, which is a part of the much broader VA VETSmile program. Only about 8% of veterans are actually eligible for dental care. It's much more restricted than general health care. And so through the VA's VOCARE VETSmile program, we want to really try to close that gap, if we can, to provide excellent oral health care for veterans who might not otherwise be eligible for it. So our program here, in collaboration with the Veterans Administration, began in July, and several hundred patients have already been seen. And the basis of it is referrals from the VA New York Harbor healthcare system refer patients to us who are not otherwise eligible for dental care through the VA. And I'm especially grateful to welcome our partners in this, Dr. Roshni Gauche, and who you will hear from today. She is the physician and the Veterans Health Administration Center for Care and Payment Innovation, the director of that entity. And then Martina Peruta, who's the director of the VA New York Harbor Healthcare System. And they both will offer their perspectives in just a few moments. We'll also hear from Michael OConnor, who I have to say was the real motive force behind NYU becoming involved in the VETSmile program. You'll hear from him as well. And I especially want to thank and welcome a number of other partners who have worked with us to make this happen. First is Craig Abramowitz, who's here. Where's Craig? Where's Craig? Is Craig over here? Yes. And Craig is the vice chairman of the Dental Care Alliance. He's a member of the Dean's Strategic Advisory Council here at the NYU Dental School. And it was Craig who brought a significant grant from the United Concordia Dental Charitable Fund in support of this very program, to provide support for those veterans that have no other source of support for their dental care. Shelby Gardner is the Chief of Staff for Representative Carolyn Maloney. I don't know if he's here right now, but he was invited, and I didn't want the opportunity to be lost to say that Representative Maloney has been a strong supporter of the dental school. Corey McGee, who I know is here, is the manager of Legislative and Regulatory Policy for the American Dental Association. And so I want to welcome all of you and thank you for being here. And now I want to introduce the president of New York University, Andrew Hamilton. Since joining as president in 2016, President Hamilton has been a tremendous supporter of the dental school, and I'm not just saying that because he's sitting right here. You don't get points for that. He helped launch this Oral Health Center for people with disabilities, which is the space we're meeting in today. He's also been a supporter of our Center for Oral Health Policy and Management, which Michael OConnor co-directs, and the director is Rick Valakovic, who's right here. And so please join me in welcoming President Hamilton.
Charles, thank you very much indeed, and I can't tell you how pleased I am to be back in the College of Dentistry after 2 years of no person-to-person meetings, no wonderful opportunities like this afternoon to celebrate everything that the College of Dentistry does for oral care in the country and around the world. And I'm just thrilled to be here, to be celebrating with all of you. And I want to congratulate the Dean and his colleagues on this very happy and important occasion, the launch of the VETSmile VOCARE pilot program. And putting an initiative like this together takes many people, takes time, takes effort, takes dedication. And I want to also just recognize and thank those partners who've made today possible, and most importantly, have made this new program possible. And first of all, let me say how honored we are that the Veterans Health Administration Center for Care and Payment Innovation, and led by its director, Roshni Gauche, we are so pleased and honored that you selected NYU Dentistry, and indeed NYU, the entire university, to implement this national program, which, as you all know, began on July the 1st. And we also thank the VA New York Harbor Healthcare System, our indispensable third partner in this project, and also thank its director, Martina Parada, for being such a key part of the team that made this possible. And this role that they play in referring eligible veterans to NYU Dentistry for continuous, accessible, and affordable care, which we all know is vital to their well-being and to reducing also their need for emergency care in hospitals. So we are grateful to them indeed as our partner. And let me also add to the thanks to Michael OConnor. Michael is indefatigable, he is energetic and full of new ideas and new ways in which NYU Dentistry can affect the world in truly positive ways. And he's the director of the VETSmile VOCARE program. And let me thank him and all of his team in helping getting this project off to such an excellent start. You know, I said I hadn't been in the college for 2 years now, and I think all of us have lived through these past 2 years learning lessons, learning important lessons, and those the pandemic has forced us all to learn those lessons of humility, of nimbleness, of adaptability, often overnight, to changing circumstances. And with those lessons in mind, NYU's College of Dentistry has managed to move forward on a series of quite remarkable initiatives, despite the uncertainties of our lives and everything that's going on at the moment. And so today's VETSmile VOCARE program, this launch, is truly a testament to that spirit of innovation and dedication during troubling times. And it's a privilege for the College of Dentistry, it's a privilege for NYU to be able to provide for our veterans who have served our nation with such courage and with such commitment. And our College of Dentistry has a long-standing tradition of offering a broad array of support and services to those who have specialized needs. And that also includes, of course, people with disabilities. This center that we find ourselves in this evening is a testament to that, and a vital part of the support of people with disabilities in New York City and beyond. And now, through VOCARE, we, the College of Dentistry, can provide our skills and our training to those who've served the nation when it's needed them, who've served the nation on the front lines. And so I'm incredibly proud of our College of Dentistry and their involvement in this very, very useful, valuable, and worthwhile project. But I also am extremely pleased to be able to be here with you all this afternoon to help launch it to a great and glorious and productive future. So thank you everyone for being here, and thank you everyone who's made this program possible. Thank you all.
I am so grateful to the VETSmile program, particularly to Dr. Roshni Gauche, not only for allowing us to collaborate here at NYU, but to do whatever we can in expanding this program to other institutions. I've had the opportunity to speak with lots of deans, more on the schedule. So far, there's been a lot of interest in what's going on here. So you can see that Dr. Gauche is a very special kind of a person. She's a physician, not a dentist, but very nice. And she has extensive experience analyzing trends in healthcare information technology development and health informatics to increase efficiencies in patient care, as well as improving the quality of care and access to care, while at the same time trying to decrease costs. As executive director of the Veterans Health Administration Center for Care and Payment, she focuses on bringing innovation, value-based initiatives to veterans. So please join me in thanking and welcoming Dr. Gauche.
Thank you. Short. Can you hear me, everything? Okay. Well, I'm Roshni Gauche. Thank you so much for having me here. I really want to thank NYU for their willingness to host this event today. And a special thanks to Dean Bertolami and Dr. Glickman and Dr. O'Connor and Gabby and Elise. Been working so hard to start this program. And NYU is serving as an inaugural location for the VETSmile program. And it's also a flagship university partner. And the outreach has been incredible. Thank you for doing that. It really helps validate our program, and it helps everyone understand the importance of this program. So the Center for Care and Payment Innovation was set up by Congress through the Mission Act, and we're here to drive innovation in healthcare for veterans. But it's also unique in that it has waiver authority, where we can change rule with congressional approval. Now, this is the first waiver that we asked for, and this waiver allows us, the VA, to refer veterans out to the community for dental care. And right now, there are about 9.6 million veterans, and only about, now the number has changed, about 15% of them are eligible to receive dental care from the VA. Of the 85% without dental benefits, there's about 1.3 million who are severely limited in their ability to receive dental care due to income. And that's the population that we're really trying to target. So in July of 2021, this year, we were able to launch this program, which is a 5-year program that's supporting the waiver. But I do want to make it very clear. It's a 5-year program for us to connect veterans to dental care. One of the unique things about this program, one that I'm really proud of, is that when the veteran is connected to a dental care partner, they can be there for their life. And NYU has graciously accepted that, and all of our other dental care partners have also taken them in, and they will become a part of a dental home, and that's where they can receive their dental care for as long as they would like. So this program has been a project of passion for both CCPI and NYU. When I visited NYU for the first time a couple months back, it was quite emotional for me. The staff was welcoming, the team was engaging, and then they brought me to this center. And I was pretty blown away by the center. It's a really special and an incredible space. And it's been developed with such attention to detail, and it's such a strong commitment to the patient experience. And so, most importantly for me, one of the ways that this partnership was even more valuable was that now we have a safe space to care for our disabled veterans. And on top of that, through some of the engagement that we have with the university, they're willing to share their experiences too with other dental schools and other students, which is an incredible component that I think that is very unique to this school, but it's really necessary to share out to the rest of the community. NYU has been more than generous in their support to our veterans, and they've embedded the mission of access to affordable care into their curriculum. And they're standing behind the tenet that the inability to pay should in no way preclude access to high-quality care. And we're really proud to announce that NYU has already seen nearly 400 patients, and we started on July 1st, which is incredible. And many of those patients have had more than one encounter. I'd like to acknowledge the pivotal role that VA New York Harbor Healthcare System has played in the launch of this program. I want to extend a special thank you to Martina Parado. She's the director of the VA New York Harbor Healthcare System and her incredibly supportive team. We were just talking about how easy she made it for this program, and now we've been spoiled. So they're the pinnacle of working with VAMCs, and this collaboration is basically serving as our model for expansion. And the referral network that's been set up between the medical side with the dental side is truly a unique model that lets us show the importance of connecting the two. Beyond these two incredible partners, we have been fortunate to have the strategic guidance and partnership of the American Dental Association. Corey's here to represent them. The VA Dentistry, the National Association of Community Health Centers, and CareQuest, who've been helping us with measurement and evaluation. So VETSmile highlights the need for dental services for our veterans and in general for everyone. It also provides a very unique platform to promote the importance of oral health. And it emphasizes how crucial oral health is for overall good health. And so as CCPI drives the VA towards high-value care and value-based care, this is going to be a key piece of the puzzle for us to be looking at the veterans' well-being in a very comprehensive way. So thank you again, NYU, and for the invitation and for the partnership.
Thanks so much, Dr. Gauche. And now it's a pleasure to introduce Martina Peruta, who's been the director of the New York Harbor Healthcare System for, I think, 12 years now. And the system has locations in Manhattan, Brooklyn, Queens, and Staten Island. They provide primary and specialty healthcare services for veterans throughout New York City. Please join me in welcoming Martina.
Thank you. It's a pleasure for me to be here. I see myself as representing the 48,000 veterans that VA New York Harbor Healthcare System treats every single year. These are veterans who put their life on the line for our nation. And I'm so glad we're doing this during the month of November, the very week that our nation celebrates our veterans and all that they've done for our freedom. For me, it's a passion to work for VA. I've worked for VA for 32 years, started as a mere administrative resident here at the Manhattan campus in July of 1989, never thinking I would become the director. But once you work in VA, there's no better mission than to serve our nation's veterans and to see what they have done for each and every one of us. So we in VA across the country pride ourselves on preventive health care, primary care, specialty care, whatever the veteran needs. But there's a gap that we have because very few, 15% of all these veterans are eligible for dental care. And that's preventive care. That's oral health care that drives so much of our quality of life. So we struggled with how can we do it? And I get the complaint department, I'm sure many of us do, but one of the biggest complaints that I would get as a medical center director is how come I can't get my teeth fixed? Well, because you're not eligible. But I'm eligible for everything else. Yeah, I get it, but the law says you can't get dental. And that's a hard sell. But thanks to this innovative program that Roshni and her team came up with, and as she said, the first partners were NYU, and we at New York Harbor stepped right in and said, okay, what do we do? And as Michael OConnor knows, we don't drop the ball. We just don't refer. We want to know, okay, what happened to that veteran? That's the way it is in VA. We see it to the end for that veteran. And if we need to intervene in any step of the way, not just here, but we're here for the veteran. It's worked very well. Veterans are very, very pleased with their ability to do this, but I think the happiest people are my primary care physicians, who every time they see a veteran, how come I can't get dental care, doc? Ah, but you can. And this gives us the pathway to be able to offer the complete package to our nation's veterans. And so I thank all of you who have worked so hard. I think there were times when Michael and I were like, what are we doing? And how are we going to get through this? But we did. It's the constant talking and back and forth and saying what's best for the veteran. That's our motto in VA. What can we do for the veteran? And I'm so glad that we've continued to partner with NYU because for all of us, We wouldn't be here if it weren't for a veteran. Thank you.
I got a flyer today, embarrassed to tell you this in a way, because I didn't know anything about it. But to show you how Care for Veterans permeates this whole organization, I got this announcement today. It says, join us for a special Veterans Day panel. It's going to be on Thursday from our Office of Development and Alumni Relations, developed independently. It just from this event, it just reflects, I think, a standing concern that our people have for taking care of veterans and doing the best that we can. So now I want to introduce Dr. Michael OConnor. Michael is the Executive Vice Dean of the college, and he's also the co-director of the Center for Oral Health Policy and Management. He really was the motivating force behind this when, I think it was on December of 2019, that he became aware of an announcement in the Federal Register about the desire to develop collaborative relationships in the community, that he really took that and led with it. I felt a lot of confidence in Michael because he's not only an expert on public health. Experts in public health are a good way to go broke. But he's also our chief financial officer. So I thought this was probably going to work. Michael's been here at NYU since 2007. Part of that, he was a senior officer at the Columbia University Medical Center. Please join me in welcoming Dr. Michael OConnor.
Thank you, Charles. Thank you very much. And thank all of you for joining us today as we launch the VETSmile VOCARE, thanks to Jean Giordano, initiative. I want to make sure I thank our partners, Roshni Gauche, who I've gotten to know a little bit, and she's just a wonderful partner to work with. And of course, Martina. Martina and I go way back. I don't know how far back, not too far back. But you said you were here 32 years with the VA. I think they must have recruited you when you were about 3 or 4 years old. Is that about right? That's exactly right. But Martina and I have worked in the past on several other projects, and she has been a great partner throughout the years and helped us out when we were in trouble with space, facilities, and some other issues that we had to work out together, some of which were challenging, but Martina was always there for us. Of course, President Hamilton, what can I say? Whenever we do something and we need, you are here for us every time, and I can't thank you enough for showing the great leadership that you have given all of us throughout this very, very difficult 15, 16 months. Your leadership has paved the way for us to have a wonderful, wonderful recovery, and all of us are very thankful to you and your team. So thank you very much. And Charles, of course, Charles gave us the green light. Charles saw the congressional record and said, Michael, what do you think about this idea? You're interested in veterans. I said, yeah, Charles, I'm really interested in veterans. And if you remember, Charles, Gabriela Gonzalez and I, Gabriela's brother was in Afghanistan, and she was very much interested in this as well. So the two of us started to think about it, but then we had to bring in the expertise of other people like Elise Bloom and Robert Glickman and John McIntosh, among others. So we put it together as a real team effort. Access to care, oral health care, is a major issue for the underserved population. And our veterans who have served our country are one such group. I want to specifically say what the goal of the program really is. The goal of the VETS program is to improve veterans' health by increasing access to dental services for enrolled veterans who are not eligible for dental services through the VA. Now, we hear different numbers. There's different numbers bantered about, but I think my numbers were in the 22 million all in the country, something like that, and about 9 million that are registered in the health services hospital system of the VA. But less than 2 million, I'll just round it up to less than 2 million, are eligible for oral health care. We're proud to say, and Roshni picked this up a couple of minutes ago, we've already in 4 months, thanks to the efforts of Martina and her team, the way we've worked it out, there's 1,000 primary care physicians in your 4 hospitals, Martina, And the primary care physicians kind of have coordinated an effort through Helen, and Helen sends the referrals every day to Gabriella, and then Gabriella goes to Nilsa, and Nilsa Dominguez takes care of getting everyone scheduled. But we've had over 500, 550 referrals. We've already seen over 400 patients, representing about 800 visits, and over 2,000 procedures in less than 4 months. Those are incredible numbers for a population that has not had dental care. With that, I'd like to beg your indulgence to relay a personal story, if you don't mind. A story that hits home and makes it real. Now, some of you know this, but most of you don't. I didn't grow up with my dad. He was not part of our family growing up. He was alcoholic and had many, many issues. As I've gotten old, when I got old, I reconnected with my dad, as many people do when that happens. And he had terrible, terrible health conditions. Terrible. And I even used Martina's hospital at one time. She probably doesn't even know that. But my father had scurvy. He had a heart attack. He had multiple eye surgeries, 2 of them in your hospital. Cancer of the throat with his larynx removed. Stroke, paralyzed from the waist down and the left side of his body. And thanks to the VA, a beautiful nursing home out in Long Island called the Long Island Vets Hospital. Great facility, state-of-the-art. Took care of my father, visited him all the time. I advocated for him on every one of those things, every one of those health conditions. The one thing I couldn't get was oral health care. I couldn't get teeth. Heart attack, stroke, eye surgeries, go down the list. Couldn't get teeth, which may have led to some of his other illnesses down the road. Okay, so why is it important to have teeth? Now, I'm not a dentist, so I make these things up as I go along, but I think they're real. I do think they're real. All right, first of all, you have poor eating habits. Terribly poor eating habits, which leads to major nutrition deficiencies. Secondly, you lose your self-esteem. You lose your self-esteem. Third, I can't see with the mask. You lose employment opportunities. How many of you, don't answer, would have the opportunity of interviewing somebody for a job or even to become a student? Don't answer, but how many would you have something in the back of your mind that says something's just not right? And you would limit that person's opportunities. Speech problems. You lose teeth, you have loose teeth, you have trouble talking. Embarrassment in going to public settings. People with missing teeth or no teeth, they won't go to a bar mitzvah, a wedding, a graduation. They don't want to be seen in public, which causes isolation, which leads to depression, pain, infections, and the worst thing for us, Charles, they don't want to smile. They just don't want to smile. So I want to thank a minute to thank the rest of the team. I already acknowledged Robert and Elise and John and Gabriella. Nilsa Dominguez, Robin Elliott, and Patricia Vargas are all helping us do our job. We're doing this because we really, really do care about it. We're passionate about it. And we are all committed to making this project a model of excellence. We want to partner with Roshni and her team to take this on a national level with the hope over time to get, and at least we've talked about it, Roshni, the hope over time is to get Congress to make an appropriation so that veterans who have sacrificed for our country get the appropriate dental care that they need. With that, I want to conclude my remarks by introducing a video in which you'll meet Leonard Ray, a veteran and cancer survivor whose illness severely impacted his oral health. Leonard tried repeatedly and without success to gain dental care. Then he heard about VOCARE VETSmile program, and it has changed his life. Rob, please play the video. And thank you all very much for being here.
My name is Leonard, and I was referred by the Brooklyn VA Hospital to the NYU Dentistry. Yeah, because I'm not covered under their insurance. They took a lot of x-rays because I had thyroid cancer and suffering from the radiation and chemotherapy, which I had 35 treatments in 7 weeks. It deteriorated the enamel and the interior of my teeth. But that's why I'm here at NYU now. My dentist here at NYU said they're going to be doing a lot of restoring of my teeth, you know, so I know it's going to be perfect. It's going to be great. I called everyone, could not get no help. But when I called Brooklyn VA Hospital, they said, we got you, and they sent me here. Having a healthy mouth means everything, not just one thing, everything. A healthy smile, healthy breath, you know, breathing, you know, is everything, you know. You can tell a person by their mouth. Well, NYU Dentistry, from just starting here, getting my x-rays and everything, is beautiful because I couldn't get help nowhere. Looked everywhere, called everybody, and my teeth was getting worse and worse. And after referral and coming here and just meeting the staff was breathtaking. And they guaranteed me that they can help me, and they are helping me. I am so grateful that the Brooklyn VA Hospital has found NYU Dentistry because a lot of other people are going to be very happy with the outcome.
Michael, thank you for arranging for that, and thank you for your comments as well. You know, this is all about quality of life. It's so central to our human existence. Now, we have with us here, I believe, Dr. Brian Eng, who is one of the practitioners located in our Brooklyn facility. And I don't know if anybody has any questions either for Brian about the care being delivered, or to any of the folks who have been up here who have spoken, any questions about the program, any issues that you'd like answered. If not, we will conclude, but if you do, now would be a good time to raise them. If anybody has any comments, questions, or insights for us. Brian came all the way from Brooklyn, but but it doesn't look like there's a lot of questions here about the technical details.
May I ask one?
President Hamilton.
You talked about the high numbers, 400, quite remarkable. How far will the program expand? How far, what is your goal to reach, 1,000 a year, 2,000 a year? What are you?
Andy, Gene, you know I have a big mouth.
This is for the live stream, so they can hear you on the live stream.
Our goal, Andy, is to bring about 1,500 unique patients into our home the first year. Each patient would probably be seen 2 or 3 times. So hence we get to 4,500 to 5,000. We're more than optimistic that as he just said on the video, word will get out. As Martina says, she has 48,000 veterans registered in her program. And that's our feeder. Martina's people have been wonderful feeding us people. So I think 5,000 visits the first year to get it off the ground is a good number. We will hit it. There's no doubt in my mind we will hit it. But I could see this program growing to 7,500 visits a year pretty easily. Thank you.
Any other comments, questions? I especially want to thank Brian because he's one of the people taking care of these patients. Any other comments, insights? If not, then let me thank you all for coming out and participating in this event. And we're really looking forward to a wonderful program that we are really committed to here in the college and at the university. Thank you.